morning, good afternoon, good evening, and thank you for joining us live from wherever you are. And those listening in afterwards, I would also like to warmly welcome our guest today, whom we're going to shortly introduce. This is an FIP event. FIP is a global body representing over 5 million pharmacists and pharmacy technicians. Pharmacy technicians are important and essential partners in advancing pharmacy practice and patient care. This year, 2025, FIP Global Pharmacy Technician Symposium highlights their growing impact across settings, showcasing how empowered support teams drive performance, how they can foster collaboration and contribute to the wider health system transformation. So join us as we explore, share successes, and envision the next chapter in pharmacy support excellence. My name is Michael Mungoma. I will be your moderator today. And I'm joining you from Kenya. I am the Dean School of Pharmacy, Mount Kenya University. So before I continue, just to mention that this webinar is being recorded and live streamed via YouTube. Second, the recording will be available on our website. That is www.events.fip.org. You may ask questions by using the questions box provided, and you can type in your questions and we will be sharing them at the end. You're also welcome to provide feedback about this webinar that we're going to have, and also become a member of FIP by visiting our website. So just remember again, all the information in the videos are confidential and cannot be copied, downloaded, or reproduced without a formal approval from FIP. So for the translation feature, we have a translation feature on the Zoom, and the steps are indicated in the video. The first step is to turn on captions as indicated step 1. And then second, enable the translation toggle by clicking on it. And then third, you can choose your preferred language under My Caption Language. That way you can follow along with our live translated captions. Welcome. So in our first session, we are going to showcase again the pharmacy technician roles. This is the second day of this series of webinars that we're having. This session will highlight the diversity of roles and responsibility of pharmacy technicians worldwide by demonstrating the work and career pathways of 2 pharmacy technician professionals from different regions of the globe. The speakers will share information about their current practice, environment, and contribution they are making as part of the pharmacy workforce and healthcare system within their local country context. So attendees will gain insights into emerging opportunities for pharmacy technicians to use their skills and enhance the impact of pharmacy services within the healthcare system. So we are joined in this session by 2 fabulous speakers, and I want to sincerely thank each of them for taking time to prepare their presentations. Today's program Like I just mentioned there, we will have two presenters, which I'm going to introduce. One of them is Catherine Dawes from Canada, and the second one will be Nelson Kipande from Kenya. And then after that, we're going to have a Q&A session. And then after that, we're going to have a wrap-up and a conclusion of this session. Our objectives today, what we intend to learn is one, identifying and comparing the roles and responsibility of pharmacy technicians in different countries and healthcare systems. And second, to identify the necessary skills and activities that would enable pharmacy technicians to contribute in the delivery of emergency healthcare services. And lastly, explore opportunities, strategies, promoting patient safety, enhancing equitable access to healthcare services through the development and application of digital health tools. I'm very excited now to introduce and present our first speaker. So our first speaker is Catherine Dawes from RPhT, pharmacy technician, logistics paramedicine from Ornge, Canada. She has been a registered pharmacy technician since 2015, has worked over 30 years in the retail and education sector of pharmacy, landed her dream job shortly after reaching her registration status. She works independently at Ornge, the air ambulance provider for the province of Ontario in Canada. Her responsibilities include collaborating with base managers, physicians, paramedics within one of North America's largest and most advanced transport medicine organizations. She oversees her overall control and management of pharmaceutical supply for Ornge bases and service agreement carriers. Welcome, Catherine Dawes, and we're really looking forward to the presentation. Welcome.
Thank you, Michael. It's a pleasure to be here. So first of all, I'd like to start off by introducing myself, and then we'll show a short promotional video. My name is Catherine Dawes. I work for Ornge, pronounced like the color orange. We're just missing the A out of the name of the company, and that was for trademarking purposes. So I've been at Ornge for 10 years. I just had my 10-year anniversary last month. I started working in pharmacy after graduating from high school, carried on my studies at night school, became a certified pharmacy technician, which was many, many years ago with the Ontario College of Pharmacists, which is a designation that no longer exists. And I worked in retail pharmacy for about 10 years. After that, I taught at a private career college. I taught the pharmacy technician program for 14 years. I was responsible for teaching every subject and every aspect of the program. So math, compounding, legislation, dosage forms, hospital practices, asepsis, professionalism, et cetera, et cetera. So I taught the whole program from start to finish. And picked up titles along the way while I was there throughout my 14-year tenure. So I was program coordinator for the province for that private prayer college, health and safety supervisor, campus supervisor, and first and foremost, pharmacy technician instructor. I thought I was in way over my head when I was teaching all of these different subjects that I didn't know much about until I started really delving into it. And then I came to Ornge, and that was, like I said, 10 years ago. So let's start with the promotional video, and then we'll get into the rest of the presentation. Thank you. Okay, thank you. So I wanted to talk about the pharmacy technician practice in Ontario, Canada. Regulated pharmacy technicians are fast becoming a major force in the delivery of healthcare in Canada. In December of 2010, the Ontario College of Pharmacists began to register pharmacy technicians. During this period, these were the first regulated pharmacy technicians in Canada. In accordance with the regulation, only those individuals registered as pharmacy technicians with the college are permitted to use the title of pharmacy technician. So it's a protected title under RHPA, the Regulated Health Professions Act, and pharmacy technicians carry the designation of RPhT. The College of Pharmacists is the registering and regulatory body for pharmacy, as well as pharmacists and pharmacy technicians practice in Ontario. Most provinces have their own College of Pharmacists or regulatory authority. In October of 2024, the Ministry of Health approved changes under the Pharmacy Act to the college's registration process. And so it offers two options now for pharmacy technicians, Part A or Part B. So Part A is for those who provide direct patient care, and Part B are for those who do not provide direct patient care. And I obviously follow under Part B. I do not provide direct patient care. That's done by our paramedics. In Canada, we also have CAPT, C-A-P-T. This is the Canadian Association of Pharmacy Technicians, which is a voluntary national organization for pharmacy technicians and pharmacy assistants. The annual fee, there is one, I think it's around $100. And CAPT offers conferences, continuing education, networking, and advocacy for the profession on behalf of pharmacy technicians. As of January 2024, there are approximately 6,200 pharmacy technicians practicing in Ontario. 2,500 are in community pharmacies, 3,500 in hospital pharmacies, and we have about just over 16,000 pharmacists practicing in Ontario. Back to Ornge. When people think of Ornge, they think of this big, sexy helicopter landing on the highway, landing on the side of the road, doing scene calls. But actually, most of our calls are interfacility. So we have a call where we go to a lower acuity hospital, pick up a patient, and take them to a higher acuity hospital. So these are interfacility transfers where we are taking patients to trauma centers. So for example, Sunnybrook in Toronto, St. Mike's, Hamilton General, London Health Sciences, just to name a few. Our helicopters are Augusta Westland 139. They're military grade, they're heavy, and they're fast. We do have three different assets, three different types of fleet within Ornge, which I'll talk about more later. But Ornge is mostly known for their rotor wings, their helicopters. We have 14 bases scattered across the province of Ontario. They're all listed there. I'm not sure if you can see too closely in the picture, but there is a picture indicating beside each city whether it's a helicopter, a plane, or a land ambulance. So the 14 bases across the province, 5 of them are rotor wing, 5 are land bases with land ambulances, and 2 of the bases are fixed wing only. 2 of the bases are both rotor and fixed wing bases. So we have many different departments within Ornge. There's a lot of background work that has to happen for our frontline workers. So essentially, Ornge is an airline company and an EMS company combined. So a lot of the background work, different departments that we have, logistics, we have a workforce planning department, operations control center, our OCC, finance, we have a clinical department, education, legal, communications and public affairs, flight operations, aviation mechanical engineers. We have a procurement department, aviation contracts, facilities, maintenance, investigations, health and safety, et cetera, and we have a pharmacy department. Our vehicles, so our assets, we have currently right now 8 fixed wing, so airplanes. By 2026, we'll be growing that to 12. And in 2027, we're looking at having 4 PC-24s, which are our jets. We have 12 helicopters in our fleet, and we have 25 land ambulances located across the province at all of our bases. Pharmacy technicians in EMS is starting to become a growing trend here in Ontario. We now have 4 pharmacy technicians working in our big cities. Inventory management is now going no longer be the problem of the EMS staff when they bring a pharmacy technician into their company. Maintaining sufficient stock levels to avoid a medication stockout is critical because it could result in a non-response. Pharmacy technicians can look after drug alerts, medication recalls, expired medication returns for possible credit if that's an option, preparing unit dose oral medications, and labeling high-risk medications. So one of the greatest challenges faced with taking on a role with an EMS organization was this huge learning curve in front of me. So not really having any prior knowledge of medical equipment or medical supplies that are used in emergency services. And even the language that was used was quite a large learning curve and a challenge for being the pharmacy technician here at Ornge. Some of the responsibilities, so narcotics, controlled substances, so balancing the daily sheets, doing month-end reports, keeping a perpetual inventory, very important to have all the documentation ready and in order. Being familiar with legislation, so keeping up to date, following along with Section 56, creating memos and bulletins. So when there's a new medication introduced into the formulary, doing a memo on the drug, doing memos for frontline staff on drugs that are back ordered, and also on medications that would have changes in appearance. Assisting with investigations, so helping brainstorm for proactive ways to prevent medication errors. For safety, there's shrink wrapping that's done with many look-alike, sound-alike drugs. When you think of a dynamic call, late at night, you're bouncing around in the back of a helicopter or a plane or an ambulance, and you have low light or low visibility, the shrink wrapping and special labeling is a huge factor and help with identifying the medication in the med bags. And inventory control. So maintaining stock levels to keep the company running. You want to avoid stockouts, but you also want to avoid wastage. One of my career highlights, Operation Remote Immunity was launched by the government, spearheaded by Ornge to offer COVID-19 vaccine to residents. Oops, there we go. So this is for the First Nation and Indigenous communities in remote areas. It included 31 fly-in communities, most accessible only by air, and all are remote. So they were having a higher risk of serious illness and challenging access to healthcare services. So with these communities having limited resources, it made the risk of the virus potentially devastating. So I was recently acquired with getting my injection and immunization certificate through the OCP, and that came in line with being able to join the Operation Remote Immunity team. So outside of dealing with the procurement and special distribution, I was able to join a team for Operation Remote Immunity. This slide specifically shows us going into Bear Island, which is a remote Indigenous community. I had an ORI team of 6, and we went in and vaccinated the community, and it was one of my career highlights for sure. Something I'll never forget. One other mission that we did, we went by plane to Pelee Island, and we flew from Toronto to Pelee Island on a different team of 6 and vaccinated the community there as well. And that's it. So I've listed my contact information, email address, if anybody ever wants to contact me and ask me any questions or looking for any information. Thank you very much.
Thank you very much, Catherine Dawes, for that exciting presentation and very, very fascinating work that you do out there in Ontario. And we'll be getting back with questions a little bit later. We'll allow all the listeners out there just to type in their questions, and we'll move on to our second speaker.
Perfect. Thank you.
So thank you so much. I'm just going to introduce our second speaker. He's called Nelson Kipande Mwalaghe. Nelson is a pharmaceutical technologist in Kenya and an award-winning digital health innovator dedicated to bridging healthcare gaps in Kenya. He graduated from Mount Kenya University School of Pharmacy. He was actually a student of mine, and he's the creator of Fortitude Formulary Guide, a pioneering mobile application that provides healthcare professionals with instant offline access to vital drug information. His work has been recognized with the Vibrant Digital Mobile App Award and has gained significant traction, including official adoption by a local county called Taita Taveta County Department of Health for use across all its public health facilities. Nelson's expertise in developing practical, context-specific digital tools that empower healthcare workers has actually had an impact in improving patient safety and driving the future of equitable healthcare in Africa. I'm going to welcome Nelson now to take us through his presentation and take us through this exciting digital platform. Welcome, Nelson.
Thank you so much, Dr. Mungoma. Good day to all pharmacists, innovators, and colleagues here. I'm excited to share how Fortitude is making a tangible difference. And on the screen, if you can, please scan the QR code for Android access to the application. Unfortunately, it's only limited to East Africa. For those beyond East Africa, you can use the web address that is the fortitude.rico ltd.co.ke web address, and you'll have access to the web application. So while you're doing that, I could just before we dive into the specifics of Fortitude, I'd like to take a brief moment to provide some context from my home country, Kenya. Uh, uh, this slide talks about locally driven tools, and understanding the caliber of the local professions is designed for is crucial. So the journey to become a pharmaceutical technologist in Kenya is a rigorous one, ensuring highly qualified pharmacists. So first, the academic bar is set high from the start. To even join a college program, you need a strong secondary school certificate with specific requirements. I think there's a C plus in mathematics, English, and the sciences. Second, this is followed by completion of a dedicated diploma in pharmaceutical technology. Third, graduation is just the beginning. You must then register with our national regulatory body, that's the Kenya Pharmacy and Poisons Board, and successfully complete a demanding 6-month internship, culminating into 2 levels of professional board exams. And then fourth, only then can you obtain your initial practice license. And finally, after 3 years of experience, your premise license matures, making you eligible to supervise or superintend a retail pharmacy, a position of significant responsibility. So why am I sharing this? Because it underscores a key point. The pharmacists and technologists using tools like Fortitude are not casual users. They are highly educated, thoroughly regulated, and deeply committed professionals. So they face complex challenges daily and deserve digital tools that match their expertise and high-stake environments they operate in. So this is the standard of practice that Fortitude is built to support. So the universal challenge. I'm going to pose a question for pharmacy technicians, pharmacy technologists, and pharmacists. Have you ever seen a clinician hesitate, rely on memory for a critical drug decision? So for a good example is when a patient comes in with pre-medication, or let's say they are under an arrangement already, and they are presenting with different diseases, and then they're prescribed additional drugs. So how can the clinician or the pharmacist, technologist, technician dispensing the drug identify if they're having interactions while giving the medication? So that's the challenge. That's the challenge most pharmacists experience. So first, it's an information equity gap. So the latest guidelines are a click away for some, a world away for others. Second, it's a connectivity barrier. Unreliable internet makes cloud-based tools useless at the point of care. So these problems converge on patient safety, increasing the risk of medication errors. So we need a solution built for this reality. The solution, or my solution, our solution is Fortitude, a professional, offline fast mobile formulary. So the core database lives on your phone or device, working with or without the internet. So its philosophy is to support, not replace, clinical judgment, standardizing care with instant information. So critically, its drug interaction checker is proven equal to giants like Medscape. This is a global standard meeting local reality. So a great tool needs a great strategy. Ours rest on 3 pillars. So one, academic validation. So Fortitude has been endorsed by Mount Kenya University. It was as an innovative project. ensuring credibility and education alignment or educational alignment. Second, public health integration. So in official rollout currently with the Taita Taveta County government in Kenya. And third, just having a sustainable revenue. So the application is free for professionals, funded by non-intrusive pharma ads. This removes cost barriers while creating a new engagement channel. So this foundation is strong as the app itself. We have, for example, here, those are the validation metrics. Fortitude is the next evolution of an application I previously developed called Dragitude, which was recognized with an award, that's Vibrant Digital's Mobile App Award of the Year, 2024, Best Digital Drug Reference App. I've taken that improvement and improved specifically engineering it to a robust offline fast formulary for professional use. I also engaged with the Kenya Pharmacy Symposium board, who confirmed its status as a reference tool, streamlining deployment. So sustainability and versus scalability. So we have a validated, approved tool. The urgent question is, how do we scale? So our principle is non-negotiable. Fortitude must remain free for end users. Uh, I have to mention that Kenya is a developing, I believe, say the word developing country, and some of these costs, especially in-app costs, deter away users, especially health professionals. So that's why it's supposed to be free. But development and training, of course, have been out of pocket. Those have been my costs currently. Our ad-based model is the goal, but engaging partners early has been slow. So the need is greatest where commercial incentives are weakest. So this is the value of debt for most social innovations. So the path forward is mission-aligned partnerships. We are not looking for customers, we are looking for champions. So we need CRS, that's the corporate social responsibility partners, to uplift public health, implementation partners, that's NGOs, to fund training rollouts, and pioneer pharma partners to invest in this unique channel. So the tool is built, the proof is live, the workers are ready. Now we need the ecosystem to build the bridge to scale. This is an investment in the infrastructure supporting every frontline worker. So the future. Our work in Kenya is a blueprint. This model is designed for global replication. Our vision is a global network of locally validated digital formularies, empowering pharmacy staff worldwide. We actively seek research partners, NGOs, and health departments to adapt this model. Together, we can turn local innovation into a global standard of care. So in summary, as I conclude, the problem is that information inequity compromises safety, that's patient safety. The solution is Fortitude, an offline fast digital formulary application. And the proof is academically endorsed. It has been government adopted and sustainably designed. So empowerment isn't just more training, it's also better tools. Fortitude provides local innovation tools that local innovation can solve global problems. So on this slide, here is Fortitude in action. Here's a clean professional interface for searching drugs and checking interactions. That's completely offline. For those who have scanned or visit the web application, that is how it looks like. So this is the tool making a difference right now in Taita Taveta County, that is Kenya. So I reiterate again, for those within the East Africa region, you can scan the QR code and you can access the app. For those beyond East Africa, please visit their website. That's their web address, that's fortitude.ridcolimited.co.ke. And you can easily access it there. It's free of charge. You can check it out. So you can experience it. For individuals in this audience who are inspired by this mission and want to support our work directly, we have our support our missions page accessible via the Fortitude app, represented by a coined dollar sign at the top upper. So it's a way to help us maintain our independence and accelerate our training rollouts. But for organizations, NGOs, and potential partners here today, our most critical ask is that you consider the partnership models we have outlined. This is the true engine that will drive Fortitude to a national and international scale. Thank you for your time.
Thank you so much, Nelson, for that, again, very, very inspiring presentation and innovation that you have shared with us. Ladies and gentlemen, this is the point where we get your questions. It's the Q&A session. And maybe as we keep looking at who has shared any questions, maybe the first question would go to Catherine after the very, very inspiring presentation. What advice would you give to EMS leaders considering adding a pharmacy technician to their team?
So pharmacy technicians, can you guys hear me okay?
Yeah, we can.
A little bit of feedback. Okay, thanks. So advice for EMS leaders considering adding a pharmacy technician to their team, I would say do it, but do it with intention. The value of pharmacy technician in EMS is tremendous, but success depends on defining the role clearly and integrating them into the system strategically. Start by identifying where medication management challenges exist. So inventory control, formulary standardization, wastage, or compliance, and let pharmacy technician expertise target those areas. Ensure that the technician has a voice at the table, so include them in logistics meetings, protocol discussions, and quality improvement initiatives. Their pharmacy background brings a different lens that can improve accuracy, safety, and accountability in medication handling. And finally, invest in relationship building between the technician and the paramedic crews. Once field staff understand that the technician's role is to make their jobs easier and safer, the collaboration really takes off. A well-integrated pharmacy technician can elevate your medication management program from functional to exceptional.
That's really inspiring, and people out there really looking at diversifying and getting into other areas definitely would consider getting into emergency services. And importantly, as you say, just the role and the expertise on medication and responding to immediate needs, I think is something that would be quite vital for emergency services. Maybe I'll also ask Nelson just one question before we see again. How do you ensure data accuracy and updates?
Okay, thank you so much, Dr. Mungoma. So that's a crucial question. So we ensure accuracy by sourcing our data from authoritative references, like the Kenya Essential Medicines List, the Kenya National Medicines Formulary. We also have the UKMI, that's the United Kingdom Medicines Information, and also the USA's drug bank database. Then through scripts, and I want to mention Python wizardry, standardize our custom database within the format our system is designed to work, and with several validation checks, of course, before final output. So for updates, we use a version control system. Updates are bundled into new app releases on Play Store or web. So this ensures users get the latest information without compromising the offline fast functionality.
Yeah, thank you so much for that feedback. I don't see any questions being typed in the Q&A, which is also symbolic of how clear and detailed the two presenters were. Maybe just one question again that I have for Catherine, if that's okay.
Sure.
Just your own experience. How does your day-to-day work differ from a traditional hospital or retail pharmacy setting?
So in an EMS environment, my work is much more operational and logistics driven compared to a hospital or a retail setting. Instead of preparing prescriptions or supporting direct patient care, my role focuses on system level medication management. So ensuring every base, aircraft, and land unit has the right medication properly stored, labeled, and tracked. Each day involves inventory control, quality assurance checks, auditing controlled substances, coordinating medication restocks, and troubleshooting supply chain or temperature storage issues. I also work closely with paramedics, logistics staff, physicians, and base managers to maintain compliance with both pharmacy and EMS standards. It's less about dispensing to individual patients, and more about building and maintaining a safe, compliant, and efficient medication system that supports pre-hospital care across a wide network.
All right, thank you. Nelson, just one question that I also have for you. There's always a question of data privacy. How do you handle data privacy with your innovation?
Oh, thank you so much, Dr. Mungoma. So that's a great question. And the answer highlights a core design principle for me. Fortitude is designed as a read-only reference tool. It does not require logins. It does not collect any patient data or even track user queries. It doesn't do that. So the application only contains the drug formulary database. Since no personal information is ever entered or stored, there is no sensitive data to be secured. We chose this privacy by design approach to make the app simple, safe, and immediately trustworthy for healthcare workers to use at the point of care without any legal or ethical concerns. Thank you.
Thank you. We have one question to Catherine there. What are the requirements of being in the team? And does a normal pharmacy technician need to undergo additional trainings to be one?
That's a great question. So EMS, Emergency Medical Services, is what that stands for. Requirements for being on the team is being registered with the College of Pharmacists. So being a registered pharmacy technician. As I mentioned in my presentation, the learning curve was huge. Everything was new, all of the names of the equipment, the supplies that are being used, what accessories go with what pieces of medical equipment. But we got there. It's just like any new job that you start in, and everything is new, and the training. So the only requirement was being registered with the College of Pharmacists and having your registration, maintaining it, paying your yearly fee, and continuing on with the licensing. Great question. Thank you.
Thank you, Catherine. We have a question for Nelson. Well, it's sort of like a recommendation. Somebody says, hi, in the UK, we have the BNF. That's the British National Formulary for Adults, and the BNFC formulary, which is for children. Would you add a section to your app for children's medication? So maybe.
Oh, thank you so much. That's a great question. Yes, I'm aware of LOS, and there is BNF. I think LOS, that's the application. There's BNF and the BNFC. Currently, we are only using already published documentation by the government. For example, our key data source currently right now is the Kenya National Medicines Formulary. So whenever this information is available after regulated, like well-published, documented information, we can easily then accommodate it and incorporate it within the app. But currently, unless we have some government incentives towards that, which I think we can pull through, we'll try and see if that can work through. But currently, the app relies on already documented and well-published information and publications.
Thank you so much, Nelson, and thank you so much, Catherine. This has been a very exciting session we've had, and we really, really appreciate your time and your attendance. You've been brilliant speakers. We hope that you're able to share again soon with us. And at this point, I just want to say good luck in everything that you do, and see you soon. I am going to hand over this to the next session, which is also going to be very, very exciting, to Terry Lynn. Thank you, everybody, for listening to me, and let's move on to the next session. Thank you.
Thank you, Michael.
Thank you.
And thank you for moderating that session so well. It's just amazing to see the versatility of pharmacy technicians globally. And it really just opens our minds to see what the opportunities are that are out there. So congratulations to our presenters as well. It was really enjoyable listening to your presentations. For session 2, we are going to be looking at professionalism and ethics in practice. It's something that I'm very passionate about, and I'm excited to hear what our speakers have to say to us today, because as vital members of our healthcare team, pharmacy technicians play a critical role in ensuring safe, effective, and ethical patient care. So this session is going to explore foundational principles of professionalism and ethical conduct, emphasizing the importance of integrity, accountability, and respect in pharmacy practice. So by understanding and applying these values in the practice environment, technicians not only uphold standards of the profession, but also contribute meaningfully to patient trust and safety. And I think we can all agree that without patient trust and safety, that the best interests of our patients are not realized. So for this session, we are joined by another 2 fabulous speakers, and I want to thank them sincerely for taking their time to prepare their presentations, and we are looking forward to hearing what you have to present to us today. I am Terry Lynn Fogarty. I am the Acting Head of Department of Pharmacy at Nelson Mandela University, and I also lecture in law and ethics, which is why this topic is so, I'm so passionate about this topic. In terms of today's program, I have done my welcome and introduction, and then we are going to firstly listen to Claire May on professionalism in pharmacy practice, a global perspective. And then we will move on to Gail Hall, who is a pharmacy technician, and she will discuss professionalism and ethics, a pharmacy technician's view. And she's got some lovely case scenarios that she will present, and we will have a Q&A and a bit of a discussion around some of those scenarios before I wrap up and conclude the session. And then we will welcome our chair of our Pharmacy Technician Advisory Committee, Susan James, just to wrap up a successful 2-day symposium. So in terms of our learning objectives for this particular session, by the end of the session, you should be able to define professionalism as it applies to pharmacy practice and identify core behaviors that demonstrate its application in delivery of patient care. We will explore common ethical challenges faced by pharmacy technicians in practice and identify some strategies to manage these situations while still upholding ethical standards. And then finally, identify tools and resources that pharmacy technicians can use to support the identification and management of ethical challenges. And so that brings me to introduce to you our first speaker. With a dynamic career spanning multiple sectors of pharmacy, Claire May brings a wealth of experience and adaptability to diverse healthcare environments. Her professional journey has been defined by a commitment to excellence, collaboration, and advancing pharmacy practice through education, research, and innovation. As a passionate advocate for the evolving role of pharmacy within healthcare, her current work explores the scope of practice and how its expansion across pharmacy professions will have a transformative impact on healthcare delivery. Her academic research focuses on the factors influencing trainee pharmacist independent prescribers in selecting their clinical area of practice, highlighting the importance of ethical decision-making, ongoing competency development, and interprofessional collaboration. She's dedicated to empowering the next generation of pharmacists through high-quality education, and she thrives in multidisciplinary teams committed to advancing pharmacy practice through policy research and global collaboration. Claire is a senior lecturer in medicine's use and the lead for interprofessional education, learning, and teaching at the School of Applied Sciences at the University of Brighton. Welcome, Claire, and we look forward to hearing from you.
Thank you so much, Terry Lynn. I really appreciate your intro. So welcome, everyone. It's lovely to have you here, and thank you for joining this session on professionalism in pharmacy practice, a global perspective. I'm really pleased to be delivering this, especially as we celebrated the World Pharmacy Technician Day yesterday. So it's such a pleasure to be here. This session has actually been shaped with valuable input from a colleague of mine, the Associate Professor Betty Char from University of Sydney, who chairs the FIP Ethics Advisory Group. Together, we've shaped a presentation that I hope you will agree explores what professionalism really means in pharmacy, shining a light on the unique and valuable perspective of pharmacy technicians. We hope this session gives you a chance to reflect, share, and connect with ideas that resonate with your own practice and context. So let's start by thinking about professionalism and what it means to us, not just as healthcare workers, but as individuals shaped by different cultures, experiences, and workplaces. We know that professionalism isn't a one-size-fits-all idea. It's influenced by the systems we work in, the values that we hold, and the people that we serve. So I'd like to invite you to take a moment and consider, how is professionalism understood where you work or in your country? What behaviours or qualities do you associate with being professional? There's not one single right answer here. So just take a chance to explore professionalism and what it looks like in real life for you. And we'll talk about why it really matters in the care that we provide. So I suppose we need to kind of take a step back, because before we really understand what professionalism means in our day-to-day practice, we kind of need to think about what does it look like to have a profession. At its core, a profession isn't just a list of tasks. It's built on specialist knowledge, ethical standards, and a commitment to serve the public. It's about continuous learning, doing the right thing, and making a meaningful contribution to your society. In pharmacy, both pharmacists and pharmacy technicians play an essential role in healthcare. And like in Canada, here in the UK, the titles pharmacist and pharmacy technician are legally protected to help safeguard the public. In the UK, that's under the Pharmacist and Pharmacy Technician Order 2007. But we know that's not the case everywhere. However, globally, the recognition and regulation of pharmacy technicians varies widely. But despite these differences, organizations like FIP recognize that pharmacy is a key healthcare profession worldwide. And with that global recognition shows the trust that is really placed in us, the responsibility that we carry, regardless of our title or where we practice. So what is professionalism in pharmacy? Well, professionalism is evident in how we treat patients, how we interact with colleagues, how we approach challenges. It's about living our values like integrity, accountability, respect, competency, and compassion in every action. So are these the kind of traits that you came up with when you took that moment to think about what professionalism means to you? Because these traits aren't just words on a slide. They're the foundation of how we show up in our roles every day. So integrity, that's of course about being honest, trustworthy, and doing the right thing even when it's really hard. Accountability means taking responsibility for our actions, learning from our mistakes, and being open to feedback. I have to say that openness to feedback, I think, is so important within any healthcare profession. And I think in pharmacy, we tend to be quite good at that. Respect, well, that's about treating everyone, whether that's patients, colleagues, and even ourselves, with the dignity and respect that we deserve. Competency, that's about staying current, being confident in our skills, and always striving to do our best. Now, I've left compassion to the end because that's the human touch. It's what helps us to connect, listen, and care in a way that makes a true difference. These aren't just nice to haves, they really are essential. And they're what helps us to earn the trust of the people that we care for and make sure our work truly makes a difference. Now, ethical conduct, that really sits at the heart of all of it. And it's what keeps our practice credible and helps us to aim for excellence. So we're thinking about pharmacy technicians. Why does it matter? And I think all of us want to understand why it matters, because then it may be easier to engage with. So professionalism isn't just a buzzword. It's the foundation of pharmacy practice. It's about trust, ethics, and that commitment that we've talked about for serving the public. Pharmacy technicians goes beyond just being theory. It's about living and breathing it. As your roles within the pharmacy workforce evolve globally, especially into those more patient-facing care roles, just like we've heard from Catherine, the way you communicate, make decisions, and support patients becomes even more important. Whether you're helping someone understand their medicines, working alongside pharmacists and other parts of the pharmacy workforce, or navigating complex situations, your professionalism is what makes a difference. It's what patients notice, what your colleagues rely on, and it helps to build the credibility of our own profession. So even though registration requirements vary widely across the world, one thing that remains consistent is that expectation around professionalism. It really is the thread that connects all of us, whether you're in hospital, community pharmacy, or supporting care remotely, or even in your Ornge helicopter. So to sum it up, professionalism isn't just about right things to do, it's about doing right by people, and that's why it matters. The FIP ethics framework, which even if you haven't already had an opportunity to look at, I would suggest you go onto the website and look it up. It really helps to promote those key principles that are universally applicable across all pharmacy practice settings. These include patient-centered care, professional autonomy. Now we'll come back to autonomy when we talk a bit more about the bioethics, ethical decision-making and transparency. So pharmacy technicians are expected to uphold these standards in their daily work, regardless of their geographical location or even the healthcare system in which they're working. So there is a real importance to be aligning these principles alongside your local practices to ensure ethical and effective pharmacy services. So I've already mentioned the word autonomy, but let's just really take a moment to reflect on these core values of our profession, the 4 pillars of bioethics. So I'm going to go through each one of them individually, and hopefully this helps to get you inspired, enthused to maybe learn a bit more. So autonomy, and what we mean by that is respecting a person's right to make their own decision about their healthcare. So that could be you've given all the necessary information to a patient to make an informed choice, and their decision is maybe different to what you think it should be after you've provided all of the information. So there's an expectation on you as a healthcare professional to respect that right to make their own decisions. Beneficence. This is acting in the best interest of the patient to promote health and well-being. So that could be healthcare professionals striving to do good, providing benefit and supporting positive health outcomes through your actions and advice. This is probably one that a lot of people are familiar with, non-maleficence, or maybe said as do no harm. So that's something that I think all healthcares hold to their core. So we mean by that avoiding actions that could cause unnecessary harm or suffering. And this principle really requires careful consideration of that risks-benefits calculator, ensuring that your interventions do not cause more harm than good. And at this point, I'd just like to point out that when I work with my students within the university, there can sometimes be a tendency for students to not make a decision. And by not making a decision, they think that they're avoiding some of the pillars of bioethics, specifically do no harm. But actually doing nothing sometimes can be worse. So we've got to be mindful that when we do make choices, how do we rationalize? How do we explain? how we've come up with that particular decision. And finally, we've got justice. So ensuring fairness in the distribution of health resources and treatment and respect. So all patients should be treated equitably, without discrimination, and with fair access to care and medicines. I think this is a key area that we're working hard on in the UK around health inequalities and trying to ensure that there's justice within the system. Of course, alongside these principles, which underpin our clinical decision-making, are values like respect, consent, confidentiality, and really that right to refuse treatment. These principles apply equally to all of the pharmacy workforce and really do form the backbone of our work. So, developing your own professional identity, it's a really important part of being a pharmacy technician, a pharmacist, or part of the pharmacy workforce. And it can be sometimes challenging as we transition from training to professional practice, because it involves more than just acquiring those technical skills. It really requires a deep understanding of one's responsibilities, values, and ethical principles. So pharmacy technicians must reflect on their behaviours and attitudes, embrace lifelong learning, and engage in interprofessional collaboration. Clearly, you know, I'm a lead for interprofessional education within the University of Brighton. And I have to say, those sessions where we bring different professions together or different arms of the same profession together, it really is special, and you start to truly understand each other. So developing that professional identity means internalizing the standards that you sign up to abide to, and thinking about the expectations of the profession and committing to both personal and professional growth. So my favorite topic, what I'm doing in my professional doctorate, looking at scope of practice. I keep saying to anyone who will listen, what an exciting time to be within the pharmacy profession. The scope of practice for pharmacy technicians alongside pharmacists is expanding in really meaningful ways. Pharmacy technicians are really increasingly stepping into roles that support medicines access, acting as patient care or engagement coordinators to help individuals navigate the healthcare landscape. I personally, in my own clinical practice, work with some phenomenal pharmacy technicians who you can see really are making a difference at the coalface. However, with the rise of automation, digital health, pharmacy technicians are having to think of other ways in which they can support medicine dispensing, serving that bridge between pharmacy operations, information technology, to ensure that safe and effective tech-enabled care. And I think that's such a key space for pharmacy technicians, because they've always been at the heart of all of those kind of dispensing systems. As patients' needs also become more diverse, pharmacy technicians are also transferring into more active roles within direct care, improving health, and really embracing the ongoing education and skill development. These emerging responsibilities reflect a shift in how pharmacy technicians contribute, not just behind the scenes, but as visible, trusted members of the pharmacy workforce. An example of that evolving role within the UK is around the supply of prescription-only medicines under patient group directions. So there have been legislative changes acknowledging that patient-facing role of pharmacy techs, which has led to the expansion of this role to improve patient access to services and increasing the efficiency of pharmacy teams. So maybe the bit that you're most interested in, ethical dilemmas. So in roles that become more patient-facing or have more patient interactions, you're likely to face ethical dilemmas, which occur frequently, and they really can be defined as the conflict between two or more of those valid principles that we've already touched on. So a common example in healthcare is a clash between the patient's right to make their own decisions, which you probably recognize as autonomy, and the healthcare provider's duty to act in the patient's best interest, so beneficence. These situations, of course, though, aren't black and white, and they really require balanced thinking so that we can take into consideration all of the evidence, objective information, and considering alternative viewpoints. Recognizing ethical dilemmas really is the first step in clinical decision-making process. So what do we mean by the clinical and ethical decision-making process? Well, it really requires a deliberate pause to reflect and consider the consequences. You need to identify all of the stakeholders involved because we need to consider their points of view. It's about thoughtfully analysing the situation, exploring the available options, and choosing the most suitable course of action, even when that decision is difficult. This approach really emphasises slowing down, applying the ethical standards, and committing to actions that uphold professional integrity and support safe and effective patient care. So we can break that ethical decision-making down ever so slightly. So we need to identify the facts. What's gone on? Who's been involved? What is it that is being asked? Always think about what the expectation is. You want to understand the moral parameters so that you can address those appropriately. Something that you might think is more fixed are the legal constraints. So what legally can we or can't we do? But sometimes this really is one of our largest obstacles to overcome. And then, of course, we have the human values. What are we wanting to do for the people that we are looking to care for? But also it might be that you're thinking about your employer or potentially your own professional registration. All of these human values really do count. So when we've identified the options, we need to really work through what each choice could be. And most importantly, what are the consequences if I do X over Y? And how does that affect all of the stakeholders involved? How do we make sure that we have got it right? And you might wonder, what does the red face test mean? Well, how would you feel explaining your decision publicly? Do you feel that you are able to justify why you've come up with what you've come up with? So think about that red face test. I think it's a really important one. How would you feel if you had to explain it? And remember that once you've made your decision, there's always an opportunity to revisit and reflect. Because although you made that decision on that day, it's possible that things may change in the future. Now, I appreciate that we've got Gail coming up and she's going to do some real life scenarios and case studies. So what I just want to do is start to get you to start thinking about some of these. So when we consider real life scenarios, we need to acknowledge that professionalism isn't just tested in the big moments. It's often in those everyday decisions that we make. So this slide is highlighting a few of the situations that some of you may have already experienced in your career. So they're familiar, sometimes uncomfortable, but they're always worth reflecting on. So if we think about a colleague who shares patient details on social media, breaking confidentiality and violating professional standards, we can review it from a bioethical perspective because we know it undermines autonomy by disregarding the patient's right to control their own information. It fails to uphold things like beneficence and non-maleficence because potential harm could be caused. If this is something that concerns you, then please look up the guidance set out by your regulatory bodies to see what their advice and guidance is. I know certainly in the UK, the GPHC, the General Pharmaceutical Council, has some very clear information around using social media. If we think about unsafe practices, well, that could be ethically aligned with non-maleficence, beneficence, because we're thinking about how this works in the best interest of the patient. So we need to just be ensuring that what we do is always upholding patient safety and professional integrity. And finally, being tasked to go beyond your competency. Now, clearly we don't have time, but I could certainly talk about this for a long time. So being challenged to do something that falls outside of your scope could conflict with the bioethical principles of non-maleficence and justice, because we might fail to provide equitable, safe care to our patients. So please do think. I hope the presentation has really given you an opportunity for a new perspective, a moment for reflection, and might even get you to think about research. So whether you're a pharmacy technician, assistant, or pharmacist, your role is essential in shaping ethical, compassionate, and effective healthcare. So let's keep learning from each other, supporting one another, and building a professional culture that reaches across our borders and puts patients at the heart. Thank you so much for your time.
Thank you, Claire, for a very inspiring and thought-provoking presentation, and also just, the ethical decision-making framework towards the end, very practical. And I know that hopefully the technicians have made some notes while they've been listening, because we have Gail Hall up next, and we're going to be looking at some real live scenarios. So welcome, Gail. Gail is a pharmacy technician. She is the pharmacy workforce lead, joined up care in Derbyshire, an associate professor in experiential learning lead at De Montfort University. She leads strategic workforce development across all pharmacy roles and sectors, and champions placements, interprofessional learning and simulation in the MPharm program. Gail is one of the first UK pharmacy technicians to undertake a research doctorate, currently awaiting her viva at the University of Leeds. Her research explores peer discussion in pharmacy technician revalidation, and Gail actively supports research capacity building, mentoring and supervision initiatives, and regularly presents at national conferences. Her work is shaping inclusive, evidence-informed approaches to pharmacy education and practice. Welcome, Gail, and we are looking forward to your presentation. Thank you so much.
Thank you so much. Thank you very much, Terry-Lynn, and thank you very much, Claire, for your presentation to introduce us into professionalism and standards and ethics for pharmacy practice. So I am Gail. I'm a pharmacy technician, and I work what we call a portfolio career, which is where I have 2 part-time jobs that make up full-time hours. So that's within the NHS for Joined Up Care Derbyshire, looking at workforce, and also in an academic role at De Montfort University, which is in Leicester in the UK. So as Claire said, in Great Britain, pharmacy technicians are a registered profession with the General Pharmaceutical Council, and they're obviously, their title is protected, as Claire said, and a profession in their own right. And I'm going to really continue on from Claire's presentation to look specifically at the importance of professionalism and ethics for my profession and yours as well, and also discuss some of the challenges that pharmacy technicians face in practice, and look at some of those tools as to how we can kind of overcome those. So I'm hoping that this works for my slides. Yes, good stuff. Okay, so I has introduced why professionalism and ethics matter in pharmacy practice, but I would now like to build on that by focusing specifically on the pharmacy technician profession. So I'm going to explore what professionalism and ethics means for us as registered pharmacy technicians, and some of the unique challenges that we face in practice, and also how we can navigate these and use the available tools and resources that we have access to. So I'm just going to start with a quick recap on why professionalism and ethics are so important for pharmacy technicians. So pharmacy technicians are those core members of the pharmacy team, and obviously we work across quite a wide range of sectors. So we've heard from Catherine, who's working in emergency services, and Nelson, who's working in innovation. I obviously have a joint role in the NHS and in academia. So there are lots of different places that we can work. This needs to come into secondary care, which is acute and mental health hospitals, community pharmacy on the high street pharmacies, and in general practice. And obviously we have those more specialised roles that some of us are in, including things like health injustice, so working in the prison sector, or even working in the armed forces. So in Great Britain, pharmacy technicians have been a registered profession since 2011, but as Claire mentioned, that's not the case everywhere. That's not even the case in the United Kingdom for pharmacy technicians, because currently pharmacy technicians in Northern Ireland are not a registered profession. So regardless of our registration status, the professionalism of pharmacy technicians directly influences patient safety and that public trust in pharmacy services, and therefore their overall health outcomes. And our ethical conduct guides really kind of help us to do that decision making and uphold the integrity of our role, and therefore the roles within the healthcare system. So let's have a look at what Claire has already outlined, really, those key traits of professionalism. So we've been looking around things like integrity and accountability. Respect was one that Claire spoke about a great deal, and competence, the ability to kind of do our jobs. And again, Claire spoke about some of the changes that are happening in Great Britain and the changes that are happening to the ability that pharmacy technicians have to work under things like patient group directions. And we also have compassion and care and communication. These are all important traits, and they apply specifically to pharmacy technicians in practice, because we're going to look at some of the ways that we kind of use those. So as pharmacy technicians, we are often working in very fast-paced, high-pressured environments. We've seen Catherine speak today, and she's working in a high-pressured environment where professionalism isn't just a concept, it's daily reality. So whether we're checking and taking medication histories on a hospital ward, or we're supporting patients in community pharmacy to make some positive lifestyle changes, or we're managing medicines reconciliation in general practice, the professionalism of pharmacy technicians directly affects patient safety and the quality of care. So let's have a look at some of these traits that we can see on the slide now. So integrity then is about speaking up, even if something doesn't seem right and it's uncomfortable to do so. So if it's speaking up about seeing something wrong that senior members of staff do, or somebody who is higher up the hierarchy chain than yourself, it's important that we have that integrity to speak up when we see something wrong. Accountability is owning our own actions, whether that's a dispensing error or it's a missed opportunity to support a patient. We need to recognise that that has happened and acknowledge it. And we also need to learn from it to try to prevent it from happening again. Respect is shown in how we are interacting with patients and their carers, and also with our colleagues, especially when tensions are quite high and we're working in high pressured work environments and there are lots of things going on. We need to have the respect that every patient is in our care. And even though it's 5 o'clock on a Friday and you should be going because you're going out, we have to treat them with the same respect and help them to solve what is their healthcare issue. Competence means that we keep our knowledge up to date and we know when and who to ask for help. So as a registered profession for our competence, pharmacy technicians in Great Britain are obviously required to undertake revalidation. That means that we have to keep our continued professional development up to date, and we have to put that towards our revalidation every year to stay on our professional register. Compassion and care are vital when we are supporting all patients, and particularly when we're supporting vulnerable patients. So for those of us that are working in mental health or emergency services, in health injustice sections, or when we are working with end-of-life care settings, it's important that we have that compassion and that we show that we care. Communication is key. Whether we're explaining the process to a patient or we're having to raise a concern with a colleague, we need to be clear and consistent in our communication methods. And these traits are not just professional expectations, they are the foundation of safe, ethical and effective pharmacy technician practice. So Claire has highlighted how ethical conduct underpins excellence in pharmacy practice and how pharmacy technicians maintain that professional autonomy within their scope of practice, which we've heard from Claire is changing on an almost minute-by-minute basis. So let's explore what this looks like now for our day-to-day work. So ethical conduct for pharmacy technicians means consistently making decisions that prioritise patient safety, confidentiality and well-being, even when under pressure or working in a complex environment. We often face situations where we must act independently and use our judgments to make ethical decisions. So some examples of those are, if we refuse to dispense a medication because it hasn't got a valid prescription, even though the patient is saying, you know that I'm on it, you give it to me every month, why can't you just give it to me now? When we raise concerns about unsafe practices or errors, even when we are having to raise those concerns about people that are higher than us, higher banded than us, or higher graded than us, or our peers. It's about respecting patient confidentiality, even when others are asking for information. So the mother that comes into the community pharmacy and asks what their daughter has just been in for, those types of situations. And this autonomy is especially important in roles where pharmacy technicians are patient-facing, or where they are working remotely from other pharmacy professionals. So those that work in environments like nursing or care homes, in education and training settings, or in the prison healthcare, where they may be the only pharmacy technician of their profession that's working there. They may work with other healthcare professionals, but they're the only pharmacy technician. So ethical decision making also involves recognising when something is out of our scope of practice. So Claire spoke quite a lot about scope of practice, and knowing when to escalate that or seek support. It's not just about knowing the right thing. It's about having the confidence and the ability to do it and to support that. So globally, pharmacy technicians may have different levels of autonomy and regulation, but the principles of ethical care remain consistent. Put the patient first, act with integrity, and maintain your professional standards. So let's now have a look at some of the ethical challenges that pharmacy technicians may encounter in their practice. These often involve navigating complex situations where professional values and those responsibilities collide. So Claire describes some ethical dilemmas, and she described ethical dilemmas as situations where two good ethical principles point in those different directions. So, for example, respecting a patient's right to make a decision about their own care, so that autonomy that Claire spoke about, versus acting in their best interest. So, for example, you've got a patient who doesn't want to take their prescribed medicine, but you believe that is essential for their care. And for pharmacy technicians, these dilemmas can be particularly challenging because we're often working at that interface between patients and pharmacists and the wider health team. So the screen on here shows 3 examples that Claire discussed, and I've just adapted those to reflect our unique role as pharmacy technicians. So these situations require us to balance our moral parameters, our legal constraints, our human values, and our professional standards. So using some of the tools like the red face tests that Claire spoke about to identify options and reflecting on those implications, they can help to guide our decisions. But most importantly, we need to feel empowered to act ethically, even when it's difficult. And that's where support and training and a strong professional culture can come in. And in the next few slides, we're going to look at 3 scenarios that pharmacy technicians can find themselves in. And I'm going to bring Claire and Terry Lynn back into the conversation at this point so that we can present these scenarios and then talk around them. So this is our first scenario, and I'm sure that many of you may be able to relate to this, so I will just read this out for you. So you are working in a busy community pharmacy, so a pharmacy that's on the high street. A colleague is loudly discussing a patient's medication, and there are other customers in front of them. You recognise that this is a breach of confidentiality, but the colleague that's doing it is a senior member of the team, and the environment is quite hectic. So we've got some questions that are kind of like posed there. So do you speak up immediately, report it later, or do you let it go? What would you do? And what support or tools could help you to handle this professionally? So let's consider what we might do then and the skills that might be able to enable this. So Terry Lynn, is there anything that you would like to say? Do you recognise this situation?
Personally, I certainly do, Gail. It's something that I think happens, I would imagine, globally, where people are within the community pharmacy and there is I suppose, a desire to do things speedily. So people maybe what might be referred to as cut corners. So instead of thinking about moving into that consultation room or moving away, So I think this will definitely be something that resonates with people. So I think maybe it's worthwhile, and I'd be interested to hear Terry Lynn's thoughts of maybe thinking about that ethical decision-making framework, you know, identifying the facts, what are the moral parameters, what are the legal constraints, if any, and what are the human values that we need to consider.
Yes, thank you. I do think that this is a global phenomenon that various technicians might come across. And I think that as technicians, the key here in this scenario is that it's a senior team member, and often may choose to be quiet rather than to speak up. And so it's not, you know, we've had the discussion about not doing anything is sometimes worse. And so in this scenario, it's about how do I go about it? I know that I need to report it. I know I need to speak up, but how do I go about that?
Yeah, I think there can be ways that you can approach the colleague discreetly, and you can do it quite respectfully. So I wouldn't advise that somebody goes up and starts in front of the customer saying, you know, you shouldn't be talking about that. You've breached confidentiality, because that is as bad as the situation that we kind of see. So we may be able to approach the colleague discreetly and respectfully and say something like, oh, I just wanted to mention, I don't know if you knew, but you could be overheard. Maybe we need to move to a quieter space, because that helps to kind of like protect the patient confidentiality without that confrontation and without bringing it to the attention of all of the patients that are in the room and listening. And later, you can always reflect on that situation. So it's one of the things that Claire was saying, just because you've made that decision doesn't mean you can't reflect on it. And maybe there's something that afterwards you may want to kind of follow up with. But for the initial situation, I think sometimes people are just not aware. They're not aware that they're speaking that loud. They've forgotten where they are, and they're not aware of the environment around them. So just mention it to them. Sorry, you know, do you know you can be overheard? Should we just move, or just trying to move them? But if it is a recurring issue, you may want to reflect on whether you need to do something more, raising it with a supervisor, or suggesting that there was a team refresher, maybe on confidentiality and protocols. I'm sure that there will be some workplace protocols for how you're supposed to undertake these discussions. Is there anything else you would like to add to that, Claire, before I talk about the skills we might need?
Well, I think that the only thing is to mention, you've said about how you frame your words. So, you know, we've very much moved away of saying, sorry to keep you waiting, to thank you for your patience. And although you're saying the same thing, because the person has had to wait, it's about that framing of the words positively. So I thought that was a really good way of you saying, you know, you're breaking confidentiality, but this may require some private space and moving over.
Yeah, I think the communication skills are a definite skill that everybody needs to support undertaking this scenario. So you've got to be able to be tactful and respectful, and remember that as much as you can hear feel that they're breaching confidentiality, to storm into that situation and shout out or call out the person in question in front of the patients is making the situation worse. You do need to have some assertiveness. You've got to have the ability to say, right, I'm going to do something about this. And Claire again spoke about that. You know, you've got to do something. You've seen something, you know it's not right. You can't just sit back and wait. You've got to do something and do some action. But the way that you do it, again, you can put that positive reframing on it. Having that situational awareness. So we've just said that the person that's undertaking this discussion loudly may not be aware of the situation they are in. You must remember which situation you are in and not breach confidentiality whilst you are dealing with the situation. So just be aware of where you are. And you need to know what your professional judgments are. So when you're going to escalate something, or whether you're going to handle it informally, So in this particular situation, if you hadn't seen this before and you felt that it was a colleague that maybe had just had a lapse in judgment and had forgotten where they were and were speaking quite loudly and hadn't realised it, then it may be something that you want to deal with informally. But if you had seen this situation from this individual continually happening, then you may need to escalate that situation. Is there anything else anybody would like to add to this slide before we move on to our scenario 2? Okay, so scenario 2 then. So this is a situation here where during a ward visit, you notice a nurse is administering medication and does not check the patient's ID, their identity. You're not trained to administer medicines, but you know that not checking the patient's identity could lead to harm. So the questions we're going to ask ourselves here are, should you intervene or escalate? And how do you balance the fact that with your scope of practice, you can't actually administer medicines, but you've got an ethical responsibility because you know that something is being done that is wrong. So again, I'm hoping that this is not a very common situation, unlike perhaps the first one was maybe a bit more common, that this perhaps is a little bit rarer, but it is a situation that can occur, particularly in busy times and times when maybe the nurse and the patient know each other very well, but you haven't seen protocol be followed. So Terry-Lynn, Claire, would you like to say anything about this one?
Yeah, I think in this situation, relationship with other healthcare professionals is imperative as well. So clearly there is a breach of protocol. At the same time, you want to respect your fellow healthcare professional. And so similarly in the first scenario, in terms of the how we go about this, I think in this scenario, it's just as important.
I think this is something where we really do need to think about maleficence and are we doing any harm? Because there is I suppose there is an inner desire, I think, in many healthcare professionals to want to support others to make sure that they're doing the right thing. And it's tricky to always necessarily point out what is happening. So I think in this instance, you might want to be considering things like mentioning to the nurse, oh, have you made that patient check? Have you, just, or saying to them, do we need to double check the ID? So putting it as a kind of a question of, I want to know what the right way is. Do we have to do it? And again, I think that goes back to your point, Gail, of maybe people just being unaware of the scenario, not realizing that they haven't done that step. Or they may come back and say, well, actually, I checked that patient's ID. I've already undertaken that and I did it X. So it's kind of also giving you that assurance that it's occurred.
Yeah, I think it is. I think it is something that you can again handle quite sensitively. You know that you've got the patient right there with the nurse. The nurse is about to administer a drug. You do not want the patient to feel that the nurse does not know what they're doing and have a reaction to that by saying, "Oh, I'm not going to take this medication." But there are ways that you can do it. So you could politely intervene and say, "Oh, I'm sorry, can I just check that patient's ID with you?" And then that puts it a little bit of it's non-accusatory, isn't it? It's opening that dialogue. So can I check that with you? Like, oh, it's me, I haven't done it. And if you do find out afterwards that, there was no check made, or if the nurse quite openly says, oh, I forgot that I was supposed to do the check, because again, busy and pressured environment, then afterwards you would need to document the incident and report it. So it is important that those things get reported through appropriate channels. So here we would report that through the DATEX system. And that's not to whistleblow on people, that's to help to prevent similar issues happening in the future. It's a training and learning exercise. So I think we've got to always think that patient safety is paramount, and we've got to understand the risks of unsafe practice. If it had turned out that that drug was not meant for that patient, that is harm to the patient. It's also harm to the nurse that has administered it as well. We've got to have some confidence and courage. We need to step into a situation here to intervene, or we need to have the confidence that and the courage to escalate that appropriately if we need to. And we need to have some interpersonal skills so that we're able to challenge practice without being confrontational. So again, like Claire and Terry-Lynn were saying, spinning it so on that positive way. I need to have some knowledge of the reporting processes as well. So I'm sure that everybody knows how to document or report incidents that they see, but make sure that you're aware of that if you're going into situations such as onto the wards, that you're aware of what the procedures are for that particular ward, so that when you see things going wrong, you're aware of how you can kind of escalate that. Is there anything else anyone would like to say on scenario 2? I'll move on to the third scenario. Okay, so our final scenario is one that is in general practice. This is a GP, a general practitioner, medic, asking for advice on diagnosis and prescribing. So this can be a common issue, particularly when it's quite difficult to know the distinction between pharmacist and pharmacy technician roles. Everybody just says pharmacy. Pharmacy, right, it's you. So they're asking the pharmacy technician to give that clinical advice on diagnosis and selection of treatment. This is not something that is within a pharmacy technician's scope of practice. We're not trained to provide clinical advice at that level. But equally, you don't want to appear completely unhelpful. So you've got to do something with this situation to kind of like respond professionally, not talk yourself out of the job by saying, oh, I can't help, I don't do anything, I can't do anything. So you've got to be careful though with balancing that, but equally you've got to work within your scope of practice. So Claire and Terry-Lynn, is this a situation that you've seen? I think I've seen this before where it's just, we're generally just known as pharmacy.
I think that can be a challenge, Gail. With regards to the pharmacy profession, I think the public awareness of the role of the pharmacist and the pharmacy technician is lacking. It's getting better.
I would agree.
It's definitely getting better. And I think through COVID, we really had a uptick on the public awareness of the role that we provide within healthcare, which was really reassuring. And of course, with our extending roles, the evolving healthcare landscape, it can be difficult for some of our other allied healthcare professionals or medical professionals to fully understand what our role entails. But I think, as you say, we can respectfully acknowledge that as much as this is something that I see that you would like support with, it doesn't fall within my remit, and maybe I could find someone else that could support with that. So I'm the pharmacy technician, and this is what I can do for you if you need some of those aspects. But if you need me to look for someone else, then certainly I can aim to help you in that way. Again, there is, I think, an inherent thing in us all that we want to be helpful, that we want to support. We don't want to let people down. So there's a concern that you lose the respect of the person that you're saying, it's not within my role. But you need to just not go, I suppose, just like doing nothing, just saying it's not in my role. It's not in my role because X. I'm giving that explanation.
I think similarly to the previous scenario, what's driving your decision, or in terms of the dilemma, is also patient safety. You're not wanting to provide information to a general practitioner that's not within your scope, that you don't actually have the information about. So just giving random information that you hope is correct it speaks again to non-maleficence. You don't want to bring harm to that patient. And so your decision to actually just say to the GP, I'm not qualified to give this advice, is important. And then I think you've both touched on the element of needing to educate the healthcare team. By the way, I'm a pharmacy technician, and clinical advice and diagnosis is the role of the pharmacist, and I'm happy to refer you on to my supervisor.
Yeah, I think that's it, isn't it? You've got to, you need to respond, and you've got to say something. You certainly can't just go away and then do nothing about it, because it's not in your scope of practice. So you need to say something and respond professionally. So something like, I'm sorry, I'm not qualified to give clinical advice on that, but I can refer this to the pharmacist, or I can help you to find the right information. So something that you can kind of do to help them. That's kind of like maintaining those boundaries still, but you're being helpful and you're being professional. And you may need to reflect here on whether the team requires some more training about the clarity of the pharmacy technician and the pharmacist role. This doesn't mean that everybody's going to always remember that and remember where we are, but we need to have that kind of self-awareness about our own scope of practice and our limitations, and maintain those professional boundaries. So we've got to maintain safe practice by saying no appropriately. So that's what we need to do in this situation. And we can help with problem solving by offering alternative solutions. So looking for the pharmacist and passing on the information to them, or signposting them to other information if that person's not available. We need to recognise the risk with those ethical reasonings of acting beyond our competence. So, any more on that situation?
Could I just say one thing, Gail? A participant, Riza, has brought a really good point to the fore, saying that as the pharmacy technician, you could potentially take down some of the queries or concerns that the doctor has, and then help with the flow of information to the correct person. And I think that's a really helpful, so you're not being, I can't do it, you're talking
no, you could take, I think that is really helpful, because again, it is saving that person, particularly if they've gone through it with you already, and told you what the situation is and what question they've got, to not pass that on. You're just forcing them to say it again to another person, whereas you could take that query and take it to another person and pass that information on. So yeah, that would be a great response. So looking at, we've looked at some of the ethical challenges that pharmacy technicians may face and the skills that we need to navigate them. But even with the right skills, these situations can be difficult, especially when we are working under pressure or we are working in isolation. But we're very fortunate because there are tools and resources that are available to support us with our ethical decision making and with our professional development as well. And these can help us to feel more confident and stay within our scope of practice and uphold the standards of our profession. So the things that you might see on this word cloud here are that we have our professional standards and codes of conduct. So in Great Britain, we have the RPhT standards for pharmacy professionals that pharmacy technicians can follow, and that provides a clear framework for ethical behaviours and professionalism. We perhaps locally as well have standard operating procedures, or SOPs, that help us to define roles and responsibilities and those escalation pathways. We may have ethical decision-making frameworks as well. So these, we could use a structured approach. So Claire has showed us some of these kind of like structured approach. Identify the facts, consider the values, explore the options, reflect, decide, justify, and then revisit. So we've got those tools, and we've seen some of those on today's presentation. Things like our incident reporting systems, so our formal recording systems, things like DATEX, which allows pharmacy technicians to report concerns safely and transparently. Mentorship and peer support as well, so talking through a dilemma with a trusted colleague or a mentor, that can quite often give you a different perspective and also give you some reassurance. And those that are completing revalidation or an annual registration and continuing professional development, they may want to use an ethical dilemma as a topic in their peer discussions or in their reflective accounts. So continuing professional development or continuing education, so ethics-focused CPD or CE programs, they can include reflective practice tools and case studies, and they can really help you to build confidence and competence. And again, those undertaking a requirement for continuing professional development or for continuing education, you might want to record the use of some of those in your annual declarations. Have professional bodies and networks, so organisations in the United Kingdom, like the Association of Pharmacy Technicians United Kingdom, so RPhT UK, they can offer guidance and support and advocacy. And obviously we've got PHIP, offering resources on ethics, professional development and global standards that support all pharmacy roles and provide events like today. So thank you very much for listening and for attending. I hope that you found that useful.
Thank you so much, Gail. I think, again, just a very practical presentation, and from the reactions I've seen, I think many people have identified with some of the scenarios and the responses that were presented. So thank you for that. We are happy to take any questions, so please type them into the Q&A box. We don't always see the questions if they're in the chat, but perhaps just to start, a question for you, Claire. Do people in healthcare all see professionalism in the same way, or does it mean different things depending on who you ask?
Thanks, Terry-Lynn. I think when we start to think about professionalism, there is an assumption that it is the same for all, but actually once we really delve into it, we realize there isn't this one size fits all, because it's very much influenced by the sector in which you work, possibly your own cultural background, what you've experienced, and a lot of the time by the people that you work with and the people that you look up to. So a lot of role modeling will go on as well. And that's important around professionalism, to realize that just because I make a decision one way does not mean that another person who is a pharmacist will make the same decision. But what we need to have is that red face test. What are we happy to talk about when we've made that decision? Do we feel confident and comfortable that it has been correct? So I think the answer to it is professionalism has core threads to it, the bioethics, but how they feed into your overall professionalism will vary slightly, as long as it's within the bounds of the regulatory standards, so the professional standards that you sign up to.
Definitely, thank you. Gail, I think we've alluded to this question in your presentation, particularly about maintaining professionalism when faced with dilemmas that involve senior colleagues or team dynamics. What tips can you give to pharmacy technicians to help them navigate those dilemmas?
Okay, well, this one can be particularly difficult for people to deal with, but you can maintain professionalism by using that respectful communication that we've talked about, but also having that assertiveness. Just because somebody is of a senior role to you, you still need to be assertive in your own profession. You are a professional in your own right, and you need to comply by your professional standards. So if, like we looked at in our scenario, you see somebody who is senior breaching that patient confidentiality, then you can make a more tactful approach. You don't have to go straight in and straight up to them, but you need to protect that patient relationship with that member of the team. So we do need to think about that. I do think that what Claire was talking about reflecting on the situation later. I think that can really kind of like help to see whether there was something a bit more deep-seated there, and maybe there was something that we needed to raise through appropriate channels. That might be something there. And you need to have those key skills. So you've got to be aware of what the situation is and what the procedures are for your particular workplace. Know what the professional standards are and your professional judgment, and have the confidence to act ethically, even if you're under pressure. So you look and you know it's a very busy environment. You can see that something's gone wrong. And you know that it's a senior member of staff, but you need to act ethically even when you're under all of that pressure.
Thank you for that. Claire, I know that it's difficult to differentiate between the importance of each of the 4 pillars of bioethics, but for yourself, which one feels the most important to you, and why?
That is a tricky question, of course, Terry-Lynn, because they all have such great importance. But I think as a professional within the pharmacy profession, and certainly within the UK, and I'm sure it's the same across the globe, our first standard of our professional standards is around patient-centered care. So I think one has to choose autonomy, because, you know, that really is about respecting the patient, honouring their right to make informed decisions. And that's a tricky one when you see a patient making a decision that you feel is very different to how you think it should go, what your treatment plan that you had in mind for that patient. And certainly we play a lot around shared decision making within the UK as being a key component of working with patients to ensure their best interests are considered. But when you do have someone who is refusing treatment, that is a challenge. So I think autonomy is really important. Of course, you know, it does fly in the face of if someone chooses not to be treated in beneficence. So, you know, you start to then, I suppose, start to delve down into the others. And so I think autonomy personally is fundamental. It empowers the patient. I think there's real need to ensure the patient feels ownership. It helps to, I suppose, foster trust in that relationship that you have with the patient because you're listening to them. And I really think that can help to embed, you know, effective communication. If you're really hearing their viewpoint and allowing them to make the right decisions for their own personal values and circumstances.
Thank you. Thank you so much for that detailed response, Claire. There's a question in the Q&A that when I first read it, I thought perhaps it's not an ethical dilemma, but it can be. The question is, as a floor manager, farm tech, do you have any suggestions on how to balance on-the-job training while doing daily operations when there is a crisis in manpower? And I think that scenario can sometimes open numerous ethical dilemmas. Gail, do you want to have a go at it, and then Claire can add?
Yeah, I think that's a very common challenge in a pharmacy setting, particularly when staffing can be very unpredictable, and balancing that kind of that training with daily operations during a manpower shortage. That really requires some sort of like flexible or maybe a kind of like layered approach. So you obviously you've got to prioritize critical training. So there are some things and essential skills that you may need to prioritize and see what you can kind of do in any downtime that you have. So training doesn't always have to be something that is like it's a 1 hour and we're going to do this training. You can do bite-sized bits of training that is for the critical training as well. So yeah, I think that shadowing and peer-to-peer support as well can kind of sometimes happen. But yeah, everybody has got. It's really difficult balancing that kind of that critical service with training, particularly when we're all under such workforce strains as well. But that would be my tip, was to try to fit it in where you can, and don't think of training as being something day to day. So
thank you so much. Claire, do you have something that you'd like to add?
I suppose I think for Raza, it's important to acknowledge like the ebbs and flow of workflow is a difficult one sometimes to predict. And of course, just as Gail said, you know, when a moment arises that maybe you've got a bit of a reduction in the workload, looking at ways in which to prioritize those critical bits of training. I appreciate in today's environment, we need to also recognize equality, diversity, and inclusion. And for those who may be neurodivergent, potentially the bite size doesn't always work because it doesn't allow for that deeper learning. So again, knowing your staff, knowing what works for them is also important to just be mindful of. I'm not suggesting that creates space, but I suppose it's just to be mindful that not everybody works in the same way anymore.
Thank you for your insights. I think that brings us to the end of session 2 for the day. And so just to wrap up, you know, thank you to everyone for engaging with us in today's session. Thank you to our speakers for their pearls of wisdom that they've brought us. I think as pharmacy technicians, you are often the first and last point of contact for your patients. You're the link between the pharmacist and the healthcare system and the public. And that means that professionalism and ethics aren't just ideals, they really are foundations of patient trust, safety, and quality care. And so I'd like you just to reflect on maybe 3 take-home messages. The first is that professionalism is who you are when no one is watching. It's shown through consistency, respect, and responsibility. And then allow ethics to guide every decision that you need to make. Even if you're unsure if it's an ethical dilemma or not, ensure that ethics guides your decision. Use an ethical decision-making framework and some of the other tools that the speakers have given you today. And then remember that you are part of the profession's image, and every interaction shapes how the public sees pharmacy as a profession globally. So let's continue to uphold the values of integrity, empathy, competence, and teamwork. Thank you everyone for your participation and your commitment to lifelong learning. And with that, I am privileged to hand over to our next speaker, Ms. Susan James, who is the chair of the FIP Pharmacy Technician Advisory Committee, just to wrap up our symposium and reflect on some of the key discussions and insights from the past 2 days. Welcome, Susan.
Thank you so much, Terry Lynn. Hello, everyone. I am delighted to be here with you today, and I have been for the last 2 days to be a part of hosting this symposium. I first want to say thank you to everyone. A great thanks to our guests today, all of our speakers, the same of our speakers yesterday. A shout out to our moderators for all of the sessions, and I will note that each of the moderators throughout the symposium are themselves members of the Pharmacy Technician Advisory Committee. They do support us in the work that we're doing, and appreciate their support and the great organization and management of the sessions that they have done over the last 2 days. I'd also like to give a big shout out to FIP staff. there are many individuals, Ines Albena, Gomez today and yesterday, who in particular have been significant players in helping to organize to make sure that everybody has what they need at the right time. Ines in particular, who does support the work of the Pharmacy Technician Advisory Committee, is just a tremendous support to us throughout the year. And of course, I want to thank everybody who has attended, whether it was just today, whether you were able to be with us live for the last 2 days, or those of you who are signing in and listening to this after the event. We do this for you. I appreciate there have been so many comments. There has been great participation through the chat from our audience. We've had a great span of individuals, and it's seeing that the interest encourages us to continue to host these kinds of events. So thank you for attending. I just want to quickly touch on the events, and particularly for those of you who may have listened today and didn't realize even, or didn't have the opportunity to listen to yesterday's sessions, just as an encouragement to go back and to pull everything together over the last 2 half days that we've had a number of sessions. I think the first thing is just to say once again, we started this symposium yesterday with a shout out to World Pharmacy Technician Day. And while we're a day after that, once again, it is much more than a day. It is every day that pharmacy technicians are contributing, playing a vital role, making a tremendous impact, and changing the lives of patients every single day. So once again, congratulations. I will just also note that as much as we refer to pharmacy technicians, you've heard throughout this session, it's pharmacy technicians, pharmacy technologists, pharmacy assistants, pharmaconomists in other countries. The terminology is global, it changes. And so as much as we use pharmacy technician as perhaps the terminology that is most common, I certainly want to make sure that we recognize all of the pharmacy professionals that are supporting this work, and know that you are included when we are referencing pharmacy technicians. Just to quickly touch on, yesterday we had 2 full sessions. The first one was focused very much on education and different aspects of education. We started with a session that shared the work that one institution in collaboration and partnership with many other institutions here in Ontario and Canada is doing to ensure that pharmacists and pharmacy technicians are learning together, that we are establishing those intra-professional collaborative partnerships and understanding of each other's roles and contributions, and how together the 2 professions are making up the whole. And that was referenced today. You heard a little bit, some reference about that work. Claire also doing that good work in the UK. It is something that is happening in many places. You will have heard here, it is a requirement as part of the education accreditation for programs, that training of within the pharmacy profession to make sure that we are at least starting with a clear understanding. And some of the research that they are doing with those sessions here, demonstrating that the value of doing that is to help promote professional identity for all of the professionals, for each of the unique roles that are being played. And that collaboration then actually does impact in the ability to manage workflow, to manage those busy pharmacies, whether that's in hospital or in community or wherever the practice is happening. That is so important. So that was just a really important session that I think we've referenced, and you've heard a little bit about, even just in this last session, the importance of that professional identity. We also had a great session yesterday that was talking about continuous professional development and a real focus on lifelong learning. And the speaker there really identified the importance of establishing what it is that drives each individual to do their own learning and to find the way to do that learning. And again, we've just talked about that, whether that is in short, bites. The speaker yesterday spoke particularly about digital tools and those short, very specific opportunities for learning. But again, really identified that every individual needs to establish for themselves what that looks like, and to establish this core desire for lifelong learning, to think about the questions. And I think that we've just had a great session about ethics, decision-making, reflection, and the individuals talked about that it's those little questions. The question that came up earlier about, how do I help people in a busy environment? One of the messages yesterday was to keep track of the little questions you have. What are those things? What are the reflections that you then, when you have the time, can go back and spend a few minutes and figure out how to do some further learning? And the last session in that particular education group of speakers was about a pharmacy technology program that has been established in Qatar. And I think it was a great session that introduced the recognition of the need for growing pathways within the pharmacy profession. It isn't all just singular. As I've just said, we have many different groups that are supporting pharmacy, and it was a presentation that demonstrated while they have a pharmacy technician specific program, they have evolved to a bachelor program that extends the role into a pharmacy technology degree, also recognized within the country. And again, we've heard in Kenya today about the pharmacy technologist programs there. So just again, recognizing that there are different streams, and it really is important to continue to keep open all of the different career pathways, because everybody has a role to play in contributing. And part of that message was also just recognizing that there are opportunities as education programs to seek out accreditation, recognition within your own regions and even internationally. We then had our first session of the showcase of technicians. Today you saw a couple technicians that was part 2 of that, and just a real shout out to those individual pharmacy technicians or technologists who have joined us to share what their own career pathway has been. They've shared a little bit about what it looks like in their own region, and that is one of the things that we know people really enjoy in these particular sessions. Yesterday's 2 speakers were both individuals who provide the leadership in their region, the United States and in South Africa, for the Pharmacy Technician Association. And you've heard the UK has an association, many places do. They were able to talk about their own development to the leadership in those roles, but also to spend some time and talk about the importance and the value of pharmacy technician or other pharmacy support associations that are separate and specific for the profession, the supports, the tools that are there to continue to support that professional identity, and to be able to represent that voice. While the intra-collaboration is very important, I think it is equally important for pharmacists and for the pharmacy technicians, technologists, to have their own organizations to come together with their very specific peers, to be able to talk about those challenges and how to establish the tools to represent that voice so that stronger together everybody comes. And that really does start, I think, with a place that you can feel is your own comfortable space to then come together and work with others and move forward to something where, like FIP, we then bring the whole group of pharmacy together. Today, I won't go over the sessions. We have just had them, except to say thank you so much. Our first session with the 2 individuals that spoke about their roles was really an opportunity to hear about some new evolving roles, the things that are not perhaps those mainstream kinds of activities that we would see in community pharmacies or in hospital pharmacies, but individuals that really are pushing those boundaries, evolving the work that they are doing. That is happening globally. So so many examples of that, and we are really pleased to be able to demonstrate and have individuals that can share that activity. And this last session, thank you so much for a wonderful session that did have opportunity for some really good discussion, some very practical conversation about the challenges and the importance of professionalism and ethics. And I think particularly that understanding, I really liked the description. I can't remember, Gail, Claire, you both referenced this, but I think it was Gail who did say, recognizing that as pharmacy technicians and technologists, support workers, you are professionals in your own right, and that is so important. And so professionalism and understanding ethics is key. It is key, as said, to establishing, maintaining that credibility of the profession for yourself, with your peers, with other team members, and with the public. And most importantly, trust, because it is the foundation of all patient care activities. And again, it is the trust. It's trusting yourself. It's trusting your peers, allowing your peers to trust you, to welcome your support. And also, again, for the public to trust in the pharmacy professionals who are meeting their patient care needs. So with that, thank you. Thank you to everybody for your participation and involvement today. And with that, I have just a couple final announcements to make. I do want to note first off that the digital event, I know many people were asking about the slides. While we do not provide the slides individually, this event is available. You can see it through the events.phip.org site. So please be sure to go there and take a look if you'd like further opportunity to see what was referenced in any of the presentations. I will also just note, and before I get to this next presentation, that membership within FIP is open to everyone. It is open to all pharmacy professionals. I think there are individuals that sometimes aren't certain about that, but I do want to welcome you to go to the FIP membership site to explore individual membership. And there are some individuals who may also be interested in understanding more about the Pharmacy Technician Advisory Committee. We encourage participation in our committee. If you are interested, it's just a matter of letting the membership office know that. They will get in touch with us, and we will reach out and let you know what's involved in becoming a member of the Pharmacy Technician Advisory Committee as well. So please don't hesitate to do that. And finally, being from Canada myself, I am delighted to be able to share just a notice and a reminder for you that next year, FIP will host its 84th World Congress of Pharmacy and Pharmaceutical Sciences, which again includes everybody, all members of the pharmacy profession. A Congress that is going to be hosted in Montreal, Canada next year. What a wonderful city. One Health, One Pharmacy, Bridging Science, Practice, and Education. So please, there will be lots of information coming out over the course of the year. Now is certainly a good time to start to take a look at this. If anybody is interested in participating with a poster, perhaps, if we go on to the next slide, you'll see what are the sub-themes for the Congress and some of the dates. I will just also encourage that we accept poster presentations for the pharmacy technician section of this Congress. And so I would encourage folks to take a look at this. The sub-themes are there. If you have information that you would like to share that you can associate with one of those themes, you see the deadlines there, and we would look forward to having you host that poster at the Congress next year. With that, I just once again want to say thank you so much for your attendance, and thank you to all of our moderators and speakers over the last 2 days, and attendees most of all. Bye for now. I hope you all have a wonderful day, rest of the evening, knowing that you are from